and Disaster Preparedness, Committee on Health, Human Services, and Homelessness, Friday, February 5th, 2021, 11 a.m. We are in conference room 329, and we will start off with our customary announcements by Vice Chair.
Thank you, Chair. Because hearings must adjourn prior to the noon floor session, not all testifiers may have the opportunity to testify. In that event, please know that your written testimony will be considered by the committee. Please keep yourself muted and your video off while waiting to testify and after your testimony is complete. Zoom chat function will allow you to chat with the technical staff, but please use that only for technical questions. If you're disconnected unexpectedly, you may attempt to rejoin the meeting. If disconnected while presenting testimony, you may be allowed to continue if time permits. Please note the House is not responsible for any bad internet connections on the testifier's end. In the event of a catastrophic network failure, it may be necessary to reschedule the hearing or schedule a meeting for decision making. In that case, an appropriate notice will be posted. Please be respectful and courteous. Disruptive behavior may be grounds for removal of the hearing. Thank you.
Great job. Thank you, Vice Chair. Okay, our first bill is House Bill 472 relating to telehealth. And let's see, first up on our Zoom testifiers is MedQuest Division, Department of Human Services, and then after that will be HMSA. So first, MedQuest.
Good morning. Thank you for this opportunity to testify. I'm Judy Moore-Peterson, the MedQuest Administrator. We stand on our written comments, providing comments on Section 4 only. Thank you.
Thank you very much. Next, we have testimony from HMSA, and then after that will be the Hawaii Psychological Association. So, Mr. Sasaki, HMSA.
Good morning, Chair Chiyama, Chair Yamane, and members of the committee. I'm Matt Sasaki, Director of Government Relations at HMSA. I want to thank you for the opportunity to submit testimony in regards to 472. HMSA is opposed to the language in this bill that removes standard telephone contacts as one of the exclusions from telehealth services. Our concern is based on the notion that currently telehealth is deemed as the equivalent as a face-to-face contact between a patient and a provider. Based on the language in the bill that is being proposed, this would then deem a standard telephone contact as the equivalent to a face-to-face with a provider, which without the face-to-face component, an examination is unable to occur, and clinically, it is not equivalent. Respectfully, we do request that the amended language that we have submitted in our testimony be considered. Thank you.
Thank you, Mr. Sasaki. Then finally signed up to testify via Zoom is Hawaii Psychological Association.
Hi, thank you, Chair Uchiyama and Chair Yamane and members of the committees. The Hawaii Psychological Association strongly supports HB 472. With the disruptions COVID has created in our personal and professional lives, the need for mental health services could not be more apparent or pressing. With the significant safety issues associated with face-to-face encounters, mental health providers and our patients have embraced telehealth as the best available form of treatment during these times. Mental health treatment services delivered via this format work extremely well. Now, one of the provisions of the bill is to allow individuals who have moved to Hawaii to continue to receive care from a mental health professional from another state with whom they have had a pre-existing professional relationship. This provision helps eliminate disruptions in patient care. HPA is therefore in strong support of this measure as we believe it promises the greatest therapeutic benefit to those clinically needing mental health services, and it promotes access to care. I might just add that with regard to telephone interventions with our patients, they are also effective and they're very helpful in situations where our patients do not have access to telehealth. So we would prefer to allow telephone interventions to be available and reimbursed if that's possible. Thank you for the opportunity to provide input on this important bill.
Thank you. I believe that was Dr. Folan. Thank you very much, Dr. Folan. Okay, that's everybody that we have signed up to testify via Zoom. Members, are there any questions? Representative Ward.
Thank you, Chair. I need some elucidation on what a gift is. I know it defines as giving labor and material of some kind. The question is, who's giving what to whom, and why is this bill saying what it's saying?
Okay, Chair, the author, I'm the author.
Okay,
So
please,
Chair,
please, enlighten me.
during the off session, we were working with various technological companies, work with Chair Woodson on the issue of broadband and having access for education, specifically for Native Hawaiian health issues, as well as making sure that all children could have broadband in order to access the DOE system. And so during that exploration, we found that there are some overlaps in which companies are willing to donate parts of the system, or for example, like hours on the Wi-Fi or routers, but they cannot donate the whole system. And because they are purchasers or procurement with the state on other issues, it would preclude them for giving a gift to assist us. So the idea was then entities could gift to the state for the use for telehealth, hard structures, or even things like Wi-Fi access and broadband support.
So this would be primarily Hawaiian Tel, Spectrum, et cetera.
This would then affect entities like
those.
Spectrum and all those, yes.
Because some of the areas not served really need that help. Big Island and other areas that are remote. really
Absolutely.
need that. Okay, good. Thank you.
Thank you, Rep. Ward. Thank you.
Chair
very
has
much.
one quick question for
Oh.
HMSA. I know I've talked with HMSA about this, but one of the concerns regarding the addition for the telephone access was that, again, in some rural areas, there is no broadband. And so if physicians are not allowing patients to go into an in-office visit due to the issue of the pandemic, and they don't have broadband, how do patients access their physicians if without a phone?
Thank you, Chair, for the question. Especially given, I think, to your question that during the pandemic and the inability to go into the office for a face-to-face visit, teleaudio is being covered under the recommendations and the rulings from both CMS and through the state during the pandemic. We understand the challenges that are being presented.
Okay, but you understand that, yes, under those, we're using a broadband type of framework is separate from doing the, using a mobile kind of situation. And the concern, the reason why the language is crafted initially that way was the concern that then we would force residents on any rural area to then leave their homes to go to a public Wi-Fi place where there's no HIPAA protections to access broadband in order to get the basic medical treatment or access to their physicians or their care. And so that's why the discussion of the using of mobile telephone access services. Is that going to be addressed by you and the other providers moving forward?
Yes, Chair, and I think I want to highlight that under our current existing payment transformation program, HMSA does cover the elements of a teleaudio communication between a patient and their provider.
Okay, thank you. Thank you, Chair.
Thank you, Chair.
Members, any other questions? Seeing none, we're going to move on to the next bill, House Bill 473 relating to telehealth. And first up to testify, we have Alani Keogh from TCCA PVL, and then after her will be Healthcare Association of Hawaii. So first start off with PVL.
Good morning, chairs. Alani Keoki, Executive Officer of the Hawaii Medical Board. I will stand on my written testimony in support of this measure and just want to note that the board does recognize that telehealth is essential to patient care and access to care both during and outside of a pandemic to diagnose, treat, and monitor illness, and is a safe mechanism to provide care. Thank you.
Thanks, Ms. Keoki. Next, Paige Heckathorn Choi from Healthcare Association of Hawaii, and after that will be JC McDonough, Queens Health System. Ms. Choi.
Hi, thank you, Chair, so much for allowing us to testify on this bill. This is one of our priority bills for this session. We really believe that it is important for Hawaii residents to be able to use telehealth. We think that we've had a permanent shift probably to a lot of telehealth services after this pandemic. And in trying to provide telehealth services during the pandemic, a number of our members and a number of folks in the community noted that essentially the way that you can establish a patient-provider relationship as it's described in the physician practice of medicine chapter is just a little unclear. So really what we're just trying to do here is clean it up, change it really from a negative that you can't do this unless to a positive and affirmative statement that you can because. So we really think that just by clarifying that, it'll standardize the language that's currently in the physician practice of medicine chapter with what else is existing in other parts of Hawaii revised statutes relating to telehealth, and just make it really clear that this is the way that patients and providers can access each other as we continue to work through this pandemic and work our way out of it, but also going forward using telehealth services. So we really appreciate the opportunity to support this measure today. Thank you.
Thank you, Ms. Choi. And then finally, Queens Health System. I'm sorry, and after that will be Kaiser Permanente following Queens.
Thanks, Chair Ichiyama and members of the committee. J.C. Mike Yellock for Queens Health Systems. We stand in strong support of this bill and will stand on our written testimony, concurring with Paige in her previous testimony. Certainly, Queens has seen and recognized the importance of telehealth systems to providing access to our patients through this pandemic and even before that. And we see this bill as an important step forward. We're here to answer any questions. Thank you.
Thank you, Mr. Michaelonic. Then next we have Jonathan Ching from Kaiser Permanente, and then following that will be AARP Hawaii. Mr. Ching.
Aloha, Chair Ichiyama and Chair Yamane. Jonathan Ching for Kaiser. We will also stand on our written testimony in strong support. I would like to just highlight one point, and I think the data really helps to show it, and we've seen it, I think in throughout the healthcare community. In 2019, just within the outpatient visits that we had, Kaiser Permanente did about 1,000 video visits. Because of the pandemic in 2020, that has drastically increased to 67,000. This clarifying amendment, which the previous testifier from the Healthcare Association mentioned, really will only help to seek to clarify that the provider-patient relationship does not have to have that, to be established, it does not need to have that face-to-face visit. And so we really think that this is going to really help to ensure that their specialists that are on Oahu and the mainland are able to have access, especially for our neighbor island community members. So thank you very much for the opportunity to testify. We're happy to answer any questions.
Thank you, Mr. Chang. Then finally, our last Zoom testifier, ARP Hawaii, Ms. Audrey Suga Nakagawa.
Good morning, Representative Ichiyama and Representative Yamane. I'm Audrey Suga Nakagawa. I'm the Advocacy Associate Director for AARP Hawaii, and AARP stands in strong support of this bill. And already, as echoed by the other testifiers, we too really value the importance and the access of having telehealth, especially during this pandemic period. We saw many of our homebound seniors and other patients who are now being able to access their physicians through this method. And of course, this is a big benefit for those who live in the rural communities, especially to our neighbor islands. And so we definitely support that. We're glad that this is clarifying this measures. And we thank you for the opportunity to support this bill.
Thank you very much. That's all the Zoom testifiers we have. So members, are there any questions? Okay, Chair just has one question for Ms. Choi, HHH. Some of the testimony raised the question of whether or not APRNs should be included in this clarification. Do you have any comment?
Sure, and I think that we've discussed this with some of our partners in the nursing community. Our understanding is essentially that within the insurance statute, it's clear that you can establish a patient-provider relationship and key on provider. So it would include all provider types. What we're really doing here is just honing in on the physician practice of medicine. So our understanding, and we can always check up on it, but our understanding is that this particular unclear language does not exist for APRNs, but we can always double check that, but that's our understanding. So it wouldn't necessarily be needed to change.
Okay, thank you. If you could please check and then just get back to the Committee on Health and Human Services and Pandemic Committee. Thank you very much. Any other questions? Okay, seeing none, we're going to move on to House Bill 1002, making emergency appropriation to Department of Health. And we have just one testifier on this bill, Department of Health.
Good morning. I'm trying to get my video started, but I'll continue. My name is Lauren Kim. I'm the policy officer from the Department of Health. The Department of Health submitted late testimony. Please accept my apologies. This is a very important hearing with a very important set of committees, and our late testimony is inexcusable. However, we are very appreciative of the support for this bill. Vaccination activities continue apace. There are many variables which precludes me from giving you a reliable figure on how much of that appropriation would be needed, but certainly additional funds are needed as we see what comes from the federal government. That said, again, we appreciate the support. We respectfully recommend this bill be moved forward with more precise figures to be forthcoming. Thank you, and I will be available for questions.
Thank you, Mr. Kim. Any members, any questions on this measure? Representative Ward.
To the Department of Health, you note that you don't have a reliable figure. How about a ballpark figure? And if it's with or without federal aid? Just, I guess it's a warm up to the Finance Committee.
Certainly. Thank you for the question, Representative Ward. There are worksheets available on the FEMA work site that use, I guess, model figures of theoretical figures that I guess are an aggregate of healthcare costs and resources across the country. Hawaii has a population of 1.4 million. The vast majority, 96% of which would be eligible for vaccination, for both vaccinations. We have seen estimates from tens of millions to a couple of hundred million. So the variability is really so great that it's really difficult to put a reliable figure on something and not have that persist in our consciousness. And so again, I'm very reluctant, but the range is from the high tens of millions to the low hundreds of millions, depending on the deployment of our resources and the levels of federal aid. And that's a total cost. That's not a proportion. This is going to be federal. This is going to be state. That's just total cost based on some rough back of the envelope calculations based on FEMA worksheets.
Sure, if I could just follow that up. The mini max stand is tens of millions versus hundreds of millions, but what do you need to get the job done that you have been tasked with? Or is that still not a certainty?
I can't answer that with any certainty. I will see where our vaccination so we have there. We need to administer 2.3 million vaccinations for a population of 1.4 million. So we know that's the end, and it really just depends on the type of contracts or the type of healthcare providers and the deployment models, and those are still in flux. We have a four-legged stool right now that consists of large contracted national pharmacies, FQHCs, small independent pharmacies, and pods. And those change every day. The conditions of our participation with the federal government in the vaccination program changes on a weekly to hourly basis. One of the greatest variables is how many vaccines are we going to get? That adds cost. If we are anticipating 10,000 1 week and we get 3,000, we stand up something in anticipation and then have to stand down. That may or may not add cost. So again, I'm sorry I can't give you a more precise figure, but the variables are continuing to be refined. And as we gather momentum in our community and we get used to this, we should be able to provide much more precise modeling and information to the legislature. We are currently in about week 6 of our max vaccination program, which started, week 4, which started in the middle of January. So we have a ways to go, and I'm sorry I can't be more precise, but we will make sure we stay on top of it and communicate as frequently as necessary to policymakers.
Thank you. Thank you, Chair.
Thank you. Members, any other questions on this bill? Seeing none, we're going to move to the last bill on the agenda, HB 1003, making emergency appropriations to Department of Health regarding COVID-19 expenditures. And the only testifier on Zoom today is Department of Health. Mr. Kim.
Once again, please excuse the late testimony. The department supports this measure and requests that it be forwarded. And with the caveat that we are unable to provide precise figures at this time, but we'll remain in contact with the legislature to make sure you have the most up-to-date information that we can provide. Thank you.
Thank you. Members, any questions? Okay, seeing none, we're going to recess for decision making. Recess. Good morning. Thank you, everybody. Reconvening the Joint Committee on Pandemic and Disaster Preparedness and Committee on Health and Human Services and Homelessness. Thank you very much to Chair Yamane for graciously allowing us to use his hearing room and date and time for this hearing. So first up, relating to House Bill 472 relating to telehealth. Recommendation is going to be to pass out of HD1. We're going to add in a purpose section. We're also going to accept the HMSA amendments regarding reimbursement for telephone calls versus telehealth. We're going to add in language to include APRNs, defect the date July 1, 2050, as well as technical amendments. Members, are there any questions? Okay, seeing none, Vice Chair Hauschka.
Chair's recommendation is to pass HB 472 with amendment. Chair and Vice Chair vote aye. Representative Cullen.
Aye.
Representative McKelvey.
Aye.
Representative Mizuno.
Aye.
Representative Wahlberger.
Aye.
Representative Woodson.
Aye.
Representative Yamashita.
Aye.
Representative Ward.
Aye.
Chair, your recommendation is adopted.
Okay, for Committee on Health, Human Services, and Homelessness, same recommendation.
Voting on House Bill 472, Chair's recommendation is passed with amendments. Chair, Vice Chair votes aye. Rep Gates, excused. Rep Har,
Aye.
Rep Capella,
Aye.
Rep Lopresti,
Aye.
Rep Nishimoto, Rep Ward.
Aye.
Chair, your recommendation is adopted.
Thank you.
Thank you. Next to House Bill 473 relating to telehealth. So for this one, members, we're going to move out of House Draft 1. We're going to defect the date July 1, 2050, as well as tech amendments. Are there any questions, PDP members? Seeing none, House Draft 1.
Chair's recommendation is to pass HB 473 with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Thank you.
Okay, same recommendation.
Voting on House Bill 473, Chair's recommendation is passed with amendments, noting the excused absence of Rep Gates. Any reservations? Any noes? Chair, your recommendation is adopted.
Thank you.
Okay, members voting on recommendation on House Bill 1002, making an emergency appropriation to Department of Health. Recommendation is to pass a House Draft 1. The amounts are already blank, so we're just going to defect the date July 1, 2050. Any questions?
Question, sure.
Yeah.
What's the difference between HB 1002 and 1003? Both appropriations, one says 2 million, the other says like tens and hundreds. Is just the amount, or is it for different use? Because they cite the same pandemic in vaccinations, et cetera.
Yes, I think the first 1002 is specifically related to vaccine planning and distribution. And then the second is related to overall COVID-19
Generic.
expenditures.
Okay,
Yeah.
thank you.
Thank you. Members, any other questions? Okay, House Draft 1.
Chair's recommendation is to pass HB 1002 with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Thank you, members.
Okay, same recommendation.
Voting on House Bill 1002, Chair's recommendation is passed with amendments. The only excused absence of Rep. Gates. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, last bill, House Bill 1003. We're going to pass out House Draft 1, effecting the date to July 1, 2050, and we're going to blank out the amounts. Members, any questions? Okay, House Draft 1.
Chair's recommendation is to pass HB 1003 with amendment. Any reservations? Any noes? Chair, your recommendation is adopted.
Thank you.
Same recommendation.
Voting on House Bill 1003, Chair's recommendation is passed with amendments. Noting the excused absence of Rep. Gates. Any reservations? Any noes? Chair, your recommendation is adopted.
Thank you.
Thank you very much, Richard.